The spread of coronavirus and constantly changing recommendations about gathering in large groups led to a lot of big cancellations. In Hampton Roads, two of the biggest ones were the Yuengling Shamrock Marathon weekend in Virginia Beach. That was supposed to start March 20th. The other, of course, is Something in the Water. It's postponed to 2021. The whole idea here is to keep people apart through social distance. But what exactly does social distancing mean? Well, the CDC says it's simple: remaining out of congregate settings, avoiding mass gatherings, and keeping your distance from people in general when it's possible. The CDC recommends keeping 6 feet between you and the person closest to you.
So we know what social distancing is, but what's the purpose? The idea is that it will help flatten the curve. 13 News Now reporter Evan Watson went to a public health expert to find out exactly what that means.
Online classes, canceled events, self-quarantines, they all have a purpose: containing the spread of COVID-19.
All of those activities have been aimed at slowing this down. If we can slow it down, then that will help ease the strain that could occur otherwise on the healthcare system.
Without protective measures, coronavirus cases could exceed the limits of the healthcare system. But with these protective measures, we can treat patients more easily. Hospitals won't be as overwhelmed and risks can be reduced.
I'm hopeful that these rather extreme measures that we're taking are going to really pay off later.
Brian Martin is the director of the Master of Public Health program at EVMS. He says COVID-19 is a virus like the flu, but it's a new virus and medical experts aren't sure how to predict its behavior.
With COVID-19, there's not only no treatment or no cure, but there's no inoculation. So anything that we can do to prevent the spread of it.
On this graph, Martin says he hopes the preventative measures keep the spread of cases below the dotted line.
What we want to see is that the load doesn't overwhelm the ability to treat the patients.
He says he knows it feels like a lot, but for public health reasons, he puts it all in perspective.
The alternative, where we don't pay attention to this virus, is that we could really see lots and lots of sick people in our community, and that death rate could go up, and we don't want that.
Evan Watson reporting for 13 News Now.
There is a big effort to protect the people who are most at risk of getting coronavirus. 13 News Now reporter Dana Smith shows us how the community is helping them.
Because of the COVID-19 outbreak, something as simple as going out to get groceries isn't possible for people like the elderly or those with compromised immune systems. So the community is coming together to help.
A lot of people that can't get out of their house right now safely to go and run the errands that they need to.
It's a group called Norfolk Grocery Runs. It's a massive community effort that started on Facebook. Here's how it works. Volunteers sign up to go grocery shopping for the elderly or people with compromised immune systems. If you need help, a volunteer will connect with you to get your money and then deliver your supplies.
So I think reality is finally setting in for people that they do need to stay home, and there are people that are either old or immunocompromised that should not be out in public.
Organizers Nick Newbold and Jenna Guerin said there are some people who are nervous about leaving their homes right now because of the COVID-19 outbreak, and for good reason. Health experts recommend those most at risk stay home and practice social distancing. Guerin said it's all about coming together to help, and in times like this, something as small as helping an elderly neighbor goes a long way.
I always want to emphasize that, this is a collective effort, that we're all organizers if we want to be.
If you want to volunteer to help, or if you need help, check out our website, 13newsnow.com, for more information. Dana Smith, 13 News Now.
The uncertainty surrounding COVID-19 and the pressure to isolate and quarantine all takes a toll on mental health. Some therapists and counselors are working from home using telemedicine to treat clients whose symptoms and conditions could get worse during these difficult times.
People with depression, for example, already tend to withdraw, have social isolation.
It's not just depression. Isolation can make other mental illnesses worse as well.
Folks with panic disorder, anxiety, folks with OCD are having a lot of problems because this is really, really a stimulus to their anxiety they already have. So we are really concerned about them.
Well, doctors say it's important to keep in contact with people. And remember, you may be physically isolated, but you can write, call, or video chat to stay connected to your friends and loved ones. And of course, if it's just not getting better, reach out for professional help.
A clinical psychologist from UVA also shared some helpful ways to keep your mental health in check during quarantine or isolation. Claudia Allen says first, get dressed. Even if you can't leave, set your alarm and stick with your morning routine. Don't stay in your PJs. Now, if you have to work from home, stick to a work routine. If you're not working, you should still create a schedule for meal times, reading, exercise, and chores. Make sure you schedule your week also and make weekends different. Do an extra activity, take on a bigger project, make a bigger breakfast even. Finally, this is a big one if you don't live alone. Be sure to spread out. Spend time in separate rooms, working, reading, learning, and get together for meals or watching movies. You can read more of Allen's suggestions on 13newsnow.com. Just search Protect Your Mental Health.
Well, self-isolation means for many that you're slowing down, you're not moving around as much and shortchanging your exercise routine. Picking up steam are those virtual workouts. Jim White explains why his fitness and nutrition studios are logging on.
And I feel at this time of crisis, exercise is important because it increases endorphins, increases mood, increases energy, and that's what we provide. We want to be a light to our community. So we decided to take this full on, especially with the new government regulations. We wanted to create an opportunity for our clients to work out in the privacy of our own home and us using technology to deliver fitness to them. And it's been a huge, huge hit.
Virtual workouts with an app or your favorite fitness instructor. It's catching on. In a time burdened with stress and anxiety, exercise helps. Many gyms across the country shut down, online moves turning up.
All people need is an area to provide exercise with an arm's length out to do body weight exercises. It's people have dumbbells or kettlebells or a gym that's a bonus, but it's not needed. We recommend if you have Bluetooth headphones to use them, but it's not needed. And we're all at the gym doing virtual training throughout the days. And we're doing it right there, just like we were with them one-on-one, but a distance apart.
Yep, it's working, and White says they'll continue the virtual workouts after this crisis passes because they're becoming so popular.
Coming up, it's the simplest thing you can do to stay healthy. Wash your hands. We'll show you the most effective way to do it.
And time for another fast fact. Should I wear a mask? Only if you're sick or caring for someone who is. Otherwise, you're using a mask someone else may need.